I'd like to just kind of ask y'all a quick question that you can respond to in the chat, which is, leaving aside what job quality is exactly or what good jobs are, why is it the job of workforce development organizations and professionals to invest in or try to improve job quality? Just really like to hear from your perspective why that should be or should not be part of our work.
And Tom, while people are typing, it looks like you're in the view where we can see all your slides.
Oh, thank you.
Yep.
I'm not working my usual computer today, so let me swap over. How's that? Thanks.
That looks great.
So one question is kind of for the clients rather than for the staff. Actually, I would think about both. Because you work for a workforce, any organization is an employer if it's got more than one person working at it, right? So it benefits community, can improve quality of life. Yes, absolutely. Any other thoughts? Fundamental human right to work, a job that treats you well. Yes, absolutely. Reduce turnover. So turnover is something that I'll actually be talking a lot about today. And that's something that speaks to, I think, the employer side of that question as well. Please feel free to keep adding your responses. I'd be happy to hear them at any point in this presentation. I'm going to say a little bit today about how we think about this question at the National Fund. And I'm going to talk about it from both the worker and the employer perspective over the course of this session. But first, I just wanted, Amanda really shared, I think, everything that was most important about us at the National Fund itself. I wanted to just say a little bit more about the communities that we work in and how we approach this work. The National Fund, as our name suggests, like we are a national workforce organization that we work kind of like a membership association. We have 32 community-based funders tables, workforce development funders, and some of their intermediary partners across the country who have been part of our network for some time. And all of us together, like we have the shared mission of collaborating with workers, with employers, and the communities that they are based in to advance a skilled workforce, promote good jobs, and invest in equitable outcomes. All the work that we do is conducted through the lens of racial equity and inclusion. We see that as inseparable from issues in workforce generally because of the nature of the racialized impact of how workforce outcomes happen in this country and the history that this country has been through and is still working through with regard to systemized racism. There are really 4 ways that we do our work, that we focus on making change happen and trying to improve outcomes. And they have to deal with the different stakeholders that ultimately impact the success of workforce innovations and how workforce organizations ultimately benefit the people that they are trying to serve. One is by co-investing. That is kind of the one that is at the center of our work. We co-invest for greater impact. We try to get within specific regions, funders to work together, rowing in the same direction, kind of agreeing on how to scale up programs. Another is by equipping workers for success. And that's the one that we all tend to think of as kind of at the core of workforce development itself. Workers benefit the most when they are trained, prepared, but also when their voices are heard and honored, and they have the ability to shape both the programs that are helping them and sometimes the employers where they are working as well, right? A third one is changing systems for improved outcomes. And this speaks to the fact that, beyond workforce organizations and workers themselves, there's also groups of stakeholders, community leaders, local and sometimes state level or national level policymakers, organizations that serve workers directly in terms of trying to address barriers to work. All of those play a really important role in the workforce development system, and we can't succeed without them. And then finally, though, the solution that I work on is called activating employers to make jobs better, because ultimately, the goal of workforce development is not just to give people jobs, but it's to help them thrive in jobs. And you can't do that without employers as effective partners, and not without employers unless they are willing to invest in the workers who they are hiring. And that's how we think about our work at the National Fund. It's very much about kind of trying to think about employer practice change and how we can achieve that at scale, learning from different communities along the way. So I really enjoyed the presentation earlier this morning about the unusual job market we are in and how we try to forecast the future from Shimura. And to some degree, what he had to say presaged some of what I would like to talk about, which is that there is a real strong business case that is happening in front of our eyes right now for why employers and workforce developers both need to think about and really invest in creating better jobs. And we see that in the monthly data that the Bureau of Labor Statistics releases, both in terms of job attachment, people's gaining new jobs, how the job market is shaping, and the JOLTS data, job openings, losses, and attachments every month. What you see here are the sector-based JOLTS reports. This is from July of this summer. It shows just very simply which sectors are gaining the most or losing the most in terms of job attachment, who's quitting their job, and how many job openings they have. And these are the 4 top sectors, which happen to be the same in both of those categories. And what you see really quickly is 3 of those 4 sectors are service industries. And in some ways, that's not surprising. I mean, the speaker this morning talked about service industry as being a category of job that people are trying to move away from. The pandemic really crystallized that. Of course, that's where a lot of the jobs that we frequently think of as bad jobs, not so good jobs are. It's also, but more fundamentally, that's where most jobs are. The US is fundamentally a service-based economy at this point. 70% of all jobs are service jobs. A lot of those are customer-facing jobs. And most of those are actually sectors that we in the workforce development space don't work that much with, right? I mean, healthcare is one that we do work with a lot, and that's a big chunk of this, but retail, accommodations, food service, those are sectors that traditionally workforce development has not quite cracked the code on how we partner effectively with companies in those sectors. I know a lot of people are working on that now, and there's some really exciting efforts, but it's a growth area for us. What we see in this data, though, is that there's a lot of, even with kind of the recent hints of contraction in the economy, there's a lot of open positions out there, and there's not enough people who are interested in filling them. And those are predominantly in these low wage sectors that often don't have the same emphasis on workforce development. So why can't these employers in these sectors fill these jobs? Well, I think you all know the reasons for this. There's a lot of barriers that are still out there that people are struggling with. The COVID-19 crisis never really ended and continues to impact especially people in terms of childcare, their ability to get to work, their feeling of safety at work, especially if they are older. Unequal labor market impacts have been heightened in the post-pandemic period, and they were already bad. There's significantly increased demand for remote work from workers, but not every workplace is actually willing to provide that. And in the last few months, we have seen a lot of workplaces that did provide remote work starting to pull back on that offering. A lot of people retired, although many of those, as Patrick said, are coming back from retirement now. Substantial reduction in the last several years in immigration and work permits, which is also contracting the labor supply. Impact of childcare and elder care staffing shortages. Those are kind of real core services that really address some of the barriers to work that people encounter. But they themselves have job quality challenges of their own that they're not quite able to figure out always how they're going to solve. And people are simply assessing for themselves, like, what is the role of work? How do I want to think about work for the rest of my life? So from our perspective at the National Fund, like, this is a job quality issue. It's not just about candidate preparation, although that is and will always be important. But solving this talent issue is going to be about focusing on job quality and figuring out how to have these conversations with our employer partners about how do we improve job quality with you and help you solve this problem that's affecting you as much as it's affecting the community you're based in. So in my job, I spend a lot of time talking to employers, and I want to say a few words about how we broach this conversation with them. What the last couple of years have shown is that for employers to grow, for companies to grow, they need to be able to attract the right people and provide the right set of incentives for them to stay in those jobs. And that's really a strategic question for them. They need to be willing to think about designing their jobs as intentionally as they design their products or design their services. And so at the National Fund, we talk about kind of job quality first and foremost as a job design set of choices. Every job that someone does in this world, every job that each of us has, was designed by someone. We may not think of it that way normally, but the fact is that jobs are designed. They are a collection of tasks and a collection of rewards that go with those tasks, as well as kind of a community that surrounds the person filling the job, right? That's what a job is. And being an employer of choice means thinking intentionally about the design choices that go into how that job is created and implemented. Companies can choose to do that mindfully. They can choose to do that as a way to build a competitive advantage in themselves, or they can try to follow what their peers do in the same industry. And most companies choose the latter path, but at the National Fund, we try to encourage companies that are in our network to really think about designing their jobs with the end of creating a better workplace in mind. We talk more and more now about workplace development alongside workforce development. And what I'm going to do in the rest of my talk here is to share a couple of tools that we have developed at the National Fund that we found useful in really working with any kind of employer and thinking through what those design choices look like. Sometimes those design choices can actually be pretty dramatic, and I want to share, I'm going to share a couple of case studies in this presentation. I want to share one of those now. This comes from a company I did some work with in my previous job, when I was also kind of more involved in the healthcare sector in particular, but still working on job quality issues. And it's a really fascinating company. There's some materials out there that I'll share that are linked to here in the slide. But it's called High Plains Community Health Center. It is a small, federally qualified center in a small town called Lamar, Colorado, in eastern Colorado, closer to Kansas. They have over 100 employees, about 10,000 patients. Most of those are quite low income. They're disproportionately Latinx, and they have a $9 million budget. High Plains was started in the late 90s, and for many years they had a lot of trouble recruiting physicians to come to this small town where they were working, and it almost drove them out of business. So what they realized is, okay, we can't get that many doctors, right? How can we deliver quality care to the patients in our community in a way that still works for them and ensures that we can do this for the long haul? And they realized that while they had a lot of trouble kind of bringing in physicians from other places, they could hire medical assistants, and they were good at that. And so what they did is medical assistants are a role that, again, thinking about design, they have a lot of flexibility in what they can actually do in a healthcare setting. They don't have a formal scope of practice. Instead, they are designated tasks by their physician, who kind of trains them and has the responsibility of making sure that they can do those tasks with quality in mind and effectively. So High Plains decided to invest in more medical assistants. They ended up hiring 3 for every physician in the clinic. And they changed their title. They started calling them patient facilitators. They equipped all of them with mobile phones at a time when that was still pretty rare. And the patient facilitators were really put in charge of managing the productivity and throughput of the clinic. But they also were incentivized. They shared in basically a revenue sharing plan, so that when the clinic was both productive in terms of seeing a lot of patients and when it had good outcomes as measured in their electronic health record, they got a small bonus, as well as the physician getting a bonus at the same time. What they found over the course of a decade implementing the system is that their rates of successful high quality care for patients with diabetes, high blood pressure, and other cardiovascular conditions went way up. And they became one of the best known kind of success stories among small federally qualified centers in the country as a result. So they improved their patient outcomes, they improved the job quality for their medical assistants, and they improved their ability to serve their community, all through this job design series of choices that they made. So again, it's a dramatic story. Not every company is going to be like this, but I encourage you to take a look at the video and case study, because it really kind of opens up what job design is all about. I'm gonna, like, keeping that issue of job design, I want to explain how we think about kind of that series of choices from the National Fund's perspective and how we talk about it with our partners. Amanda, I can put the link in at the end of the discussion, but it's also linked to directly in the file that you shared. So there are two tools that we use at the National Fund to kind of help employers and the collaboratives that we work with think about job quality or quote unquote good jobs. And I say quote unquote not because I don't think good jobs is a thing, but there are other organizations out there that really focus on kind of how do you define what a good job is. And that's not the line of work that we are in. Instead, kind of recognizing that, you know, workforce development folks, we work with employers that are all over the spectrum. We want to provide a framework for helping employers think about how do we get better at creating a workplace? How do we get better about providing jobs that people want to stay in? And the job design framework is intended to help employers understand that series of choices. And the way the full framework is on our website, but the way that we essentially describe it is that we see it first and foremost through, again, the racial equity lens, so a racial equity frame. Since race is kind of the biggest determiner of workforce outcomes when it comes to how workers thrive or don't thrive in the workplace. Everything that we say kind of in terms of the pillars is surrounded by that. Within that frame, we see four main areas where workers, basically there are characteristics of the jobs that they inhabit that they value. And we divide these into pillars, which we describe as core pillar, which has to do with kind of the real basic, kind of the things you cannot live without. That's compensation, the environment that you're working in, the safety of your job, and the quality of your supervision. The second pillar is the support pillar, which has to do with how well you feel supported by your workplace in addressing those barriers to work and stabilizing your life. And so that has to do with kind of entry-level training, the kind of internal assistance programs that your employer provides, which can include things like an EAP, but in our view should go beyond that, and external support programs of other kinds, of availability of tax credits that your employer makes to you. I'll give a couple more examples on the next slide. The third pillar is the opportunity pillar. That's your ability to move up into your job and really develop a career out of it. And so that is kind of the core of career development, but it also includes things like having peer mentors at work, having coaching from your supervisor who actually kind of invests in your career as well, and just receiving simple acknowledgement and praise when you do a good job. The final pillar is voice, and that is the extent to which employees are asked and kind of engaged to be co-creators of the workplace with their managers, and they have agency at work. And we are increasingly seeing that as kind of, while we don't consider it part of the core, as really kind of essential, and something that, in past decades, past years, the importance of it, the fact that employees really want to have agency and the ability to inform the development of their workplace is something that we think is really important, has been underestimated in the past. I see we have a question in the chat about being a hybrid employer as a people-serving business. I think that is something that can be, and to some degree, this next slide addresses it, attractive to a potential employee, right? It's something that people see as a benefit, especially when there's this uncertainty about it. But it raises questions about the business model and how that business model gets implemented that are more achievable in certain sectors than others. I don't know if that addresses your question, but I'm happy to speak more to it. It's basically both a real pro for a lot of people and sometimes a constraint, depending on the kind of business. This is the full job design framework. I'm not going to talk through each item, but you can see here kind of different examples of the things that we think about as core, support, opportunity, and voice. What I want to emphasize more here is kind of, this is a menu-like structure, right? What we do when we talk through this document with employers is we try to help them think about, what are your strengths right now? What are your weaknesses? Where are areas where improvement is most possible? You don't necessarily have to start on the left and move your way right. Sometimes you really want to figure out kind of where the low-hanging fruit is first. If there is an area where you think an improvement can be made that will be valued by your employees, that's where you should start. You don't have to do everything all at once. We use this tool for many years. This has been a core part of the National Fund's work, I think since about 2013, the job design framework, and it has evolved a little bit over time. But one thing that we often got questions about, and which most of the rest of my presentation will really address, is how the employer can think about these practices, these job design choices, and connect it to the KPIs, the benchmarks, the numbers, the metrics that really matter from an organizational point of view. And in the past couple of years, we have done some work to really investigate that and have some exciting findings to share. Before I move on, though, any questions about the job design framework and how we've structured it? And pardon, I'm just looking at the chat again. So yes, in nonprofit, but I think in a lot of for-profits too, like there is a lot of people, I think especially now, feel that kind of doing work that is related to their mission in life, feeling that their work is purposeful and meaningful, absolutely is something that people attach to being a good job. And that meaningfulness can also kind of include, I think for a growing number of people, whether or not your workplace is one that puts an emphasis on equity and inclusion in all of its spaces, as Jovan points out. I think that's also true, though, that where we would put that piece is less of, I would not consider that to be a separate pillar. We would consider that part of voice, and that the mission of the organization reflects the things that the employees of that organization think are important as well. And that people are really have the ability to work for companies or nonprofits that reflect their values and the change that they want to see in the world. That is voice as it partially applies to recruitment and worker job opportunities. So I want to share one more case study before I move on to the next tool. This is a company that, full transparency, has their vice president of human resources is on our board of directors. But I was familiar with them long before that. They are a really fantastic employer that does a lot of things differently and very intentionally compared to some of their peers, and has done a lot to kind of lead the development of a stronger workforce and workplace development system in their region. This company is Optimax Systems. They are a producer of high quality customized lenses for things like telescopes and cameras. If you have seen pictures from the any of the Mars rovers, it is likely that those lenses were taken through a lens that was made by Optimax. They do a lot of work with NASA. They are a modest-sized company. They've got about 400 employees, $50 million in annual revenue. And the founders of the company, when they started it, they knew they wanted to create a great place to work and really prioritize that from go. They have seen low turnover pretty much every year since they were founded over 20 years ago. And the reason for that is that they do a lot of things kind of with the emphasis on what do our employees value, what will make this a better place to work for them, so that they really prioritize the needs of the client and can address that. And a few other sample practices are here. Again, I'm happy to share a case study. There's actually one, there's one on the Aspen Institute EOP website, but Optimax has their own case studies that they have shared as well on their website. Some of these things are things we might be familiar with. You know, they have a very kind of well-defined internal career lattice, I would say. They have a really cleverly designed 360 review process that we at the National Fund ended up adopting and adapting for our own use a few years ago. They develop personal learning plans for every employee and provide full tuition reimbursement. They also do profit sharing in a really pretty dramatic sense. 25% of their profits every single quarter are shared with their employees. And they've maintained that commitment through decades now, and have found it to be a very effective way to engage workers and kind of help their employees understand the financial needs of the company as well. And then finally, a couple of years ago, Optimax became 100% employee owned, and they're actually one of the first companies in the US to develop a form called what's called an employee ownership trust, where the company is basically owned by a nonprofit organization that is, in its bylaws, it has to consider the employees to be the first and primary stakeholders in the company. Beyond that, they also co-founded their own workforce development collaborative in the Finger Lakes region of New York, which is called FAME, and did a lot to kind of get that off the ground and brought in other optics companies and other advanced manufacturers along for the ride, and have gotten great traction that way. So as I mentioned before, the job design framework was our primary tool for talking with employers for many years about what do employees value, what are the job characteristics that they care about. And it was based on kind of interviews with subject matter experts who really had deep knowledge of worker voice and employee needs. But we knew we wanted to go beyond that. And so a couple years ago, with funding from the Bill and Melinda Gates Foundation, we embarked on a new project with a workforce development evaluation company called it's a Workforce and Organizational Research Center. And their founder, a close colleague named Dr. Ellen Frank Miller, came up with this really fascinating research project for us that has been kind of, for the National Fund, a pillar of what we share with employers ever since. And that we call that the job quality outcome maps. And I do say maps rather than map, because there's a big one, but there's also some kind of zoomed in ones. The basis for this product, the research and the research behind it, was really a literature review, which is that we asked the work team to look at the last 50 years of organizational science literature and basically just try to assess for us what were the employer outcomes that were measured most consistently, and what kinds of investments did companies that experience those outcomes make into their workforce. And what you see here is kind of a real short summary of what they found. And this consists of a lot of studies. They basically went through a whole bunch of meta-analyses that covered roughly 3,000 studies, some of which were random control trials over a 50-year period. What the work team found is that there were 5 employer outcomes that were measured in that time period based on validated scales, which simply means that they were measured in a pretty consistent way. And those are turnover intention, which is when an employee says to an interviewer on an anonymous survey, they say, I'm thinking about leaving my job in the next 3 to 6 months. That's turnover intention. The second one is commitment to the organization, which is sort of the reverse of turnover intention. It's when an employee says, I'm so committed to this job, like their problems are my problems too. The third employer outcome was individual performance. And that's when an employee kind of rating their own performance says, I can do my best work in this organization. The fourth outcome, which is probably the one that has been the most studied of these and best known, is engagement at work, which is when an employee says, I have the tools, the training, the support needed to do my job well. Again, it's closely related to individual performance, but it's a little different. And the fifth one, which is one that we're all a lot more attuned to lately, is burnout, which is when an employee says, my job exhausts me. I find it physically, mentally exhausting to do this work. What Dr. Frank Miller, what Ellen and her team found is that there was a collection of job characteristics that were positively associated with each of these employer outcomes. And you can see kind of the grouping of them. There's actually 26 characteristics in total. But we decided to group them in these 7 kind of big categories, which are elements of the job experience, pay and benefits, health and safety, work-life balance, the terms of employment, representation and voice, and supervision quality. I can show you, however, all of the 26 characteristics on this next slide. This is kind of the big job quality outcomes map. And what you see, I know some of this may look pretty small, is each one of the kind of big categories is on the right. You can see them kind of counting down from the top from elements of the job experience. And then within those, you see other kind of more specific job characteristics that are within those. So for instance, elements of the job experience includes things like role stressors. Do you know what is expected of you at work? It's a very well-known question from the Gallup organization and their employee engagement survey. Task variety. Do you get to do a variety of things? Does your task feel important? Or do you have to just do one thing over and over again? Perceived support from the organization or from your coworkers. Do you have an organization? Do you work in a place where there's mutual helping, where people kind of take care of each other, or is there conflict? Does the organization foster competition among its employees? Scheduling practices is one of the ones that fit under work-life balance, also much studied with some really powerful random control trials about stability and predictability of scheduling. Work conditions is one that's under health and safety, and so on and so forth. What you see under each of the characteristics are these little signboards that are color-coded. Each one of those just indicates which of the 5 employer outcomes they are associated with. So role stressors, again, at the top is associated with all 5 outcomes. Benefits is only associated with turnover. Doesn't mean it's not important, but that's where it is associated across the literature. Now, I know that slide is a lot to take in, so let's just zoom in a bit on the individual maps. This is the map for turnover intention. And what you see here, again, is that there is 1, 2, 3, 6, 7, there's 11 job characteristics that are positively associated with turnover intention. So when an employee expresses more satisfaction with improvement in any one of these job characteristics, they are unlikely to also say they're intending to turn over in the next 3 to 6 months. This doesn't mean that it's causal. I want to be really careful and say that these are correlations, not causations for the most part. But for an employer, if you're thinking about how to improve turnover, right? You look at the economy today and you're like, we got to improve our turnover because it's killing us. These are some of the things you might consider investing in, or at least exploring with your employees as ways to improve the company. Doesn't tell you exactly what to do. It doesn't tell you exactly what to measure, but it tells you what not to measure and kind of what path not to go down and what might be fruitful. So one of the things that's associated with turnover intention is opportunities for training and development, opportunities for advancement. No surprise there. That's something those of us in the workforce development field know just through experience is something that people value. This is the scientific validation of that experience. Perceived support from your supervisor or from your coworkers, that's something where workforce development folks on kind of partnering with employers is a little newer. There's definitely a lot of work out there in the last several years, kind of focusing more on supervisory training, for instance, but it's a new field for us to be getting into, but this is a strong validation that it's probably a worthwhile one for us to look at. I'm going to show another map. This is, well, I'm not going to show all 5, but this is commitment to the organization. It's a couple less characteristics here than with turnover intention. But again, what you see is that there's some interesting similarities. Role stressors, of course, shows up again. Benefits is not here, but the skill level required is here. And autonomy, control, independence is here. These are, again, kind of if you want to design a survey to evaluate what your workers will value on the job and what might create a better workplace ultimately, this map can help you guide the development of that survey. Let's look at one more, which is burnout. Again, you're going to see some similarities, some differences. And again, these are pretty logical ones, right? Like safety, probably something that would affect burnout. You would anticipate it would, and it does. Physical demands at work, of course. If you're working really hard physically, if you feel bone tired, then you probably are more likely to feel burnout. But then again, there's the commonality as well. Opportunities for training and development actually is correlated with reduced burnout on the job. And that's not something we in the workforce development field tend to think about first and foremost, but it may be a way for our employer partners to really kind of think about what other factors could shape their choice of how to make jobs better. So this, I've got a few more slides to share about our job quality maps, but I do want to pause here to see if there's anything in this data that I'm sharing that y'all have questions about or could use a little more explanation. Deal with burnout and a couple other places. That's something that people may not factor into how it's going to affect them over time. And it, of course, is more prevalent in some kinds of jobs than others. So how do we use these job quality maps? And I want to kind of back up for a second and say, like, we created these maps specifically for an employer audience, thinking about them primarily. But we also recognize that employers are fundamental partners of workforce developers. And we wanted to make sure that this was a tool that workforce development organizations could use in conversation with their employer partners to, again, improve outcomes for everyone involved. So the way we do it, the way that we, and we're still learning, is that first of all, we start off with the end in mind. The goal of this is to help the employer solve a problem within their workplace that is holding back the success of their organization, while also solving a problem for the people who work for that employer or the people we're placing with them. So what are the most pressing business imperatives for that company? And are they connected in some way to those 5 employer outcomes in the map? And sometimes the connection may be, there may be some translation that's needed or connections that may be needed for the employer. But I think the economy, the way that the economy in large has been shaped in the last couple of years is making that picture a lot easier for folks to see. So for instance, a couple of weeks ago, there was a really fascinating article in Bloomberg by an investment advisor named Connor Sen. who was talking about how turnover may be the biggest problem that most employers are having right now because of how it's infecting their productivity. In the first half of this year, the US was still growing in terms of total jobs, but productivity fell. And he theorized that productivity was falling because so many people were leaving their jobs and starting new ones that A, there's a lot of orientation, a lot of getting people up to speed in their new jobs that employers were having to do. And B, that creates additional pressure on the people who've been at a job for a long time, which may cause them to quit and kind of causes this not so great, not so virtuous cycle. Which is to say that a lot of employers historically have kind of seen turnover as an indirect cost, but they're coming around to the idea now that it actually can be a direct cost for them. And seeing people in the the world of high finance saying that really clearly, for me, I thought was really powerful. Once you identify that imperative, kind of what's the thing keeping the leader of the company up at night, identify what the barriers are and figure out kind of what is within these job quality maps, what are areas that could help you address that barrier. So again, kind of going back to High Plains, the community health center I talked about before, wasn't for them, it was really about their challenge in recruiting doctors and how could they improve the productivity and of their current group of physicians without compromising on patient safety and patient quality. And they came up with an intervention that really worked for that purpose and also made better jobs for most of the people working there. Once you do that, kind of you can use the maps to identify what is this area of focus, how are we going to interview or survey our workers about it, and can the workforce development partner help with that process in some way? Can you identify an evaluation provider in your region that could do that with an employer? Can you help think about kind of worker voice panels? Can you interview employees directly or hire someone who can do that? Partnering that kind of back and forth with employers is kind of a crucial piece of this, and I think adds a lot of value and kind of helps frame that that transition from workforce development to workplace development. And then finally, kind of being collaborative, being creative in how you address the partnership with this employer. Kind of if one thing doesn't work, being ready to move on to the next. We have collections. We're fortunate to have collections of job characteristics associated with each of these outcomes. And sometimes one that you choose as the first path is not right, but just being ready to move on to the next one, the maps are still there to guide you with that process. And then finally, kind of what you can do tomorrow. Like I'm really asking kind of as workforce development agencies ourselves, how do we think about our role in this, our work in this? Like, so one thing I would look at is in your community, and I suspect the answer for most of us right now is yes. Like, how much of the emphasis right now is on the supply side, increasing the supply of workers with a particular credential or background? Because there's certain things we can do about that, but we're going to run into some hard realities with it as well. Ultimately, like we are in a more constrained labor position as a society than we have been in some time. And I think a lot of us are still trying to figure out how do we operate effectively with that. What on the other side, what is the demand side, the employers, how can they co-invest with us in talent as a business strategy for themselves? How can they kind of take the first steps in making their workplace more attractive, making their jobs better? Stepping back to and thinking about who you as a workforce development agency are working with in the first place. How do you select employers to be your partners? What do you know kind of going into that relationship about their investment in workers, how they think about retention? There are a lot of employers out there that think about retention as a negative, that actually welcome churn and turnover, especially at the front lines. Whether that's good or bad for their company, but it's just the way that they have been trained in thinking about it. I think it's important for workforce developers to really think critically about who we want to partner with, who's going to ultimately create the best outcomes for the people we're trying to serve, and who's being helped or left behind. A big challenge we're trying to figure out the National Fund right now is how do we effectively partner with employers, especially those in multiple locations, to disaggregate data by demographics, by race, by gender, by disability, and so forth. And getting outside the traditional pools of talent that they tend to focus on within their trade. And then I know we've got about 10 minutes left. I definitely want to save time for questions. I will say that this is basically part one of connected to another tool that we're optimistic about talking to y'all about later on, which is how do we actually do the hard work of engaging worker voice in that job design, that workforce development process. We created one more tool that I didn't have time to get in today, which is our guide to developing a human-centered workplace. And this tool, which came out of the same investment from the Gates Foundation, was really kind of strongly validated by a number of companies that we and the collaboratives we work with partnered with directly on it. And we saw great outcomes for workers and for their employers through the kind of the challenging but also simple approach of really getting employees involved in the design of the place where they work. And so I'll be excited to talk with you all about that at a later point. With that, thank you all for having me here today. I'm happy to take any other questions.
And feel free to unmute and just ask if you don't want to put it in the chat.
Hi, this is Jesse, one of the field specialists with the California Workforce Development Board. Thank you, Tom, for such detailed just look at your really, how you look at worker voice, employer needs. With the High Road field team, with our High Road training partnerships, we really advocate for bringing industry-driven solutions that bring in both employers and workers at the table. And one thing that stood out to me, you brought up the case study with Optimax, and
Yes.
And how they became employee-owned. That's definitely one thing that I've been thinking about. Is have you seen any increases in employee ownership? I mean, that's a big question. I don't know if there's data behind it.
I'm happy to say what I know. As Amanda mentioned in the beginning, I'm also on the board of a very small nonprofit in Atlanta where I live that's focused on trying to promote employee ownership. It's a topic that I've been passionate about for a long time. My understanding of the data, for one thing, the data on kind of the conversions, employers that sell their company to their employees through an ESOP or a co-op or some other vehicle, it's pretty slow data, and it's gotten slower because of COVID. So I don't know what the larger trends are. In general, over the last couple decades, the number of employee-owned firms in the US has gone down slightly. I think it used to be more like 10,000, and now it's down to about 7,000. But the size of those firms has generally increased, so that the number of employees working in an employee-owned space has remained stable or even grown somewhat. That said, it's only been in the last few years that there's been a real concentrated effort by folks in the nonprofit space to kind of identify like why employee ownership may be something worth investing in, and to promote the idea to other companies. So I'm optimistic about it as a long-term strategy, but it is a thing that should be understood about it is a slow process. Optimax, I think they had a lot of great workforce practices. They were doing their profit sharing program maybe 15, 20 years ago. They went for it for a long time, but it's only in the last 3 years that they became employee owned. In general, I would say that it is a good strategy to work with companies on things like profit sharing and becoming more transparent as a route to employee ownership rather than try to get them to dive in on the deep end. I hope that answers your question.
No, definitely. Thank you so much.
I see we have a question in the chat too about kind of budget limitations and how we address kind of job quality, and especially kind of from a kind of for organizations that may be government funded or part of government. I think that's a great question. And it's one we also get a lot at the National Fund. So I'll say a couple things about that. One is that I do think there's a lot of value in talking about job quality and what we can do as a sector to promote it, including with folks in government, and getting them to think about what kind of role they can play in their own organizations as well as in who they fund. I will say that, we hear the same concern from employers too, though, right? Like they'll say things like, we really want to make this a better place to work, but we just can't invest more in payroll right now. Or if we, if we raise wages for people kind of for medical assistants in our organization, like there's a real cap that we're going to get to. And if we get to that, then we're going to have to also raise wages for LPNs. You hear things like that, that it just starts to accumulate and they can't handle it from a budgetary standpoint. What I would say to that are two things. And one is why we have the job design framework as a menu, right? It's not always about salary. It's not, I don't want to say that salary or compensation is unimportant, because I think it's greatly important. But there are other ways to address job quality issues. And in general, your employees can tell you what they are. That's why I think even more in some ways than compensation, I would say worker voice and worker engagement is central. And workers should understand, like, when there is a budget constraint, like how that's impacting the organization and what can be done besides increasing salaries. That said, I also think companies, thinking more of the private sector now, they sometimes maybe need a little help using their imagination as to how they can increase compensation. And I recognize that budgets, in government and in some kinds of nonprofits, budgets are set in this hard level that's hard to work with. But for-profit companies often can, if they engage their employees to really understand the business and help them sell their product or help them be more cut costs or be more successful in other ways, they can share the returns of that with their employees. And that one way that can take form is through higher compensation. From a nonprofit or government standpoint, I would say, you've got to make the case slowly for how you invest in people and kind of thinking about how they might, leave the sector for another one. But you also need to kind of think about what else can you do? How can you empower people? How can you engage people? How can you create a more supportive culture within your organization, even if it doesn't take the form of higher compensation immediately?
May I mention something on that, please?
Absolutely.
And I don't know how much this is just specific to us, but what I'm really speaking to a lot, I mean, we pay decent wages, and I've looked them up in LA County, and for a nonprofit, and we really push to do that. So it's not so much the wages. What I'm really talking about is what I am experiencing for nonprofits getting government grants is a huge increase in accountability. And you know what, we'll give you whatever we want, but I don't see the commensurate increase in indirect cost allowed. And so, for example, we have a grant, not from this particular funder. When we got the grant, they literally trained the group of grantees to say your invoices are going to be almost a ream of paper every month. So when you have those kinds of pressures, we started down some of these paths about a year ago. We had some trainers, we got them going. I have not had a minute to even look at it since we started. And I hate to start something and not finish it. But this is due tomorrow. Hey, you got 24 hours to get back to us on this. Not seeming to realize people are on vacation. We're a small staff. We don't have a bench of people to send it over to. So you got to drop everything, get this done because the grant's calling for it. And we love the grants, but I just feel like that is somehow getting lost in the shuffle about what is being required of us, and then wanting very much to do many of the things that you're talking about. And then you don't want to tick off a funder, you know, so
Yeah,
I just feel like there needs to be almost somebody else other than we working and getting the grants to say, wait a minute here, you know, the indirect cost rates haven't gone up in a very long time. And how do you keep asking for more and more and more accountability without that kind of being looked at? So I'll shut up now, but it's a big concern, at least for me. Thank you for that.
thank you for sharing that and for that clarification. And yeah, we don't have a lot of government grants, but I hear you. I mean, it can be the case with any grant that there's always this kind of push and pull around indirect costs and how, you know, how certain kinds of work like ends up getting unfunded because of that. Is the simplest way to put it. I think, again, there's kind of a longer term conversation and a shorter term one. And a shorter term one occurs internally, and how you figure out, like, you know, how do we ultimately make this work? And that can be hard. But the longer term one needs to be with funders, and they needs to help them understand like what the impact of the funds ultimately are and these constraints can be. But I hear you, and I also think I am out of time. Thank you very much for joining me today.
Thank
I
you so
haven't-
much, Tom.